Hello everyone and welcome to another video of Medicine in 10 minutes or less. In this series of videos, we discuss different topics in a short and summarized way to help you memorize and prepare for your exams. Today we have a short topic, but very important and very common, which is chronic cough. We will discuss a short and summarized way to approach such cases and help you memorize important points. So grab your coffee and let's go. First thing we should do is to define what a chronic cough is. Chronic cough is the one that lasts for more than 8 weeks. First thing we should assess is the history of the patient and make sure that if the patient is taking any ACE inhibitors. If the patient is taking any ACE inhibitors, we should stop the ACE inhibitors at once or change it to one of the ARBs. If the patient is not taking any ACE inhibitors, we should proceed to do a chest x-ray for the patient. If there are any abnormalities of the chest x-ray, we should do further testing depending on the findings. Other options for the testing include sputum cytology, modified barium esophagography, pulmonary function test, HRCT, bronchoscopy, and cardiac studies. And this, as we said, depends on the findings of the chest x-ray. If the chest x-ray is normal, we should evaluate for common conditions. The common conditions that cause chronic cough include 3 main causes. The first one is called post-nasal drip syndrome. Now, the diagnosis of post-nasal drip syndrome is confirmed by the improvement with the usage of first-generation antihistamines, like, for example, chlorpheniramine. Chlorpheniramine provides specific H1 antihistamine receptor blocking, which reduces histamine action on H1 receptors, decreases allergic response, and it has anti-inflammatory effects. Also, it blocks the histamine release from mast cells and limits secretory response to inflammatory cytokines. All of these points will lead to improvement of the cough if the cause is post-nasal drip. Another treatment option is also intranasal fluticasone, which is corticosteroids. If the post-nasal drip syndrome is excluded, we should think about GERD or gastroesophageal reflux syndrome, and in this case, the treatment will be omeprazole or one of the protein pump inhibitors. If the GERD is excluded, we should think about asthma, and in this case, we should treat with short-acting beta agonists. Other conditions include eosinophilic bronchitis and habitual cough. In eosinophilic bronchitis, we should confirm the diagnosis by sputum smear and look for more than 25 eosinophils in the smear. The treatment will be inhaled corticosteroids. So there you have it, a quick and easy to follow map to approach any case of chronic cough. I hope you found it useful and see you in the next video. Don't forget to like and subscribe to our channel to see the next videos.